Hey. Test, test.
Honey, wake up.
Yeah, what's going
Wake
on?
up.
I'm awake on breakfast already, boy.
No, it's not that.
Yeah.
Your legs. What's wrong with your legs? You keep moving them.
Yeah, so what?
Oh, there's another dream about running down the street in your Nikes?
No, they're just bothering me.
Oh, is it painful? Like you have cramps or something?
Doesn't actually hurt, but it feels like water running down my leg.
Oh, are you sure the water sensation is not actual water running down your legs?
Gamal, are you trying to peed on myself?
Oh, no, I'm
That's
just...
not funny.
Okay, I think we should follow up with the doctor.
Yeah, okay. First thing tomorrow morning.
Okay, Doc.
Actual water running down her. Anyway, my name is Roland. I've been assigned to watch over Layla throughout her pregnancy, and I literally mean watch her. I've got Dr. Hussein and Rice with me for a consult. What was happening to Layla's leg? That was a bit abnormal. Is that to do with her pregnancy?
Well, it's not just limited to pregnancies, there are a lot of causes. For starters, her condition is called restless leg syndrome. It's a neuromuscular disorder of the limbs where the patient tends to move their leg to relieve their discomfort. Other patients may mention painless tingling sensations.
All right, well, you've mentioned a lot of causes. It says here that in a cohort study done, 26% of women who had RLS tended to stop after pregnancy. They also had lower hemoglobin concentrations.
That's right. In many cases, we associate iron deficiency anemia with RLS. Other associations are smoking, neuropathy, nephropathy, diabetes, and excessive caffeine consumption, among other things.
All right, well, this seems like a weird but simple pregnancy quirk to go through.
It is not simple at all. Other than the decreased quality of sleep and life, there is a reported high coincidence of coronary artery disease. Also, for women with RLS for more than 3 years, there is an elevated risk of non-fatal myocardial infarction and fatal coronary heart disease.
All right, well, Layla is a bit anemic. How do we treat this in time and prevent it from progressing even further?
Layla does blood tests throughout her pregnancy. A correlation between her complaints and the result would help diagnose it.
As for treating it, it's mainly symptomatic. Since the only cure is possible for secondary RLS, we can prescribe Layla some iron tablets. If drugs are indicated, we can go for opioids given for a short time to avoid withdrawal in a born child, and possible anticonvulsants.
As a general rule, we'd like to avoid medications in the pregnant women, so we'd recommend exercising, leg massage, hot or cold baths, whirlpool baths, or vibratory stimulation of feet and toes.
All right, that looks like fun.
Oh, what woke you up?
I haven't been to sleep yet.
Yeah, why is that? It's 3 a.m.
Every time you take a breath, it sounds like a train passing over my head.
What, train?
You snore like a cow or God knows what.
Oh my God, honey, you broke my heart.
Oh, would you rather get deaf?
Well, no, but no one ever told me I snored before.
Because no one hears this and live to tell about it.
Well, I don't trust you. I'll ask the doctor about that tomorrow.
Oh, thank God we're not charged by the question. We would be broke.
Gamal, funny Gamal, it's 3 a.m. You have work in the morning, don't you? Just get some sleep.
I'll try.
All right, well, at least he's finding the humor in this. I myself am a little worried over Layla. Up until a couple of months ago, she was a sound sleeper, and now she snores in her sleep and gasps in the middle of the night.
It is not as bad as it could be. These episodes of snoring and gasping are a result of a sleep condition known as sleep apnea. Did you know that in some severe cases, it may get up to 30 episodes an hour, each lasting 10 seconds? That is 40 minutes of no oxygen consumption per night.
All right, well, hers aren't that frequent. She gets about 16 episodes a night, I guess. What causes this?
The airway itself collapses during her sleep. It's usually accompanied by heavy snoring until she gasps for a breath and then it repeats again. What's interesting is that the patient aren't aware of this until someone tells them, and the only outward manifestation is deteriorated sleep quality.
Earl, and how many women get this?
The latest percentages show that 14% of the pregnant women have sleep apnea, as opposed to 4% of the non-pregnant population.
No, that's a bit odd. Why the increase with pregnancy?
That is because obesity is a major risk factor, so with the excessive increase of body weight ends up with pressure on her neck and throat. But there is also the swallow nasal passages due to the increased estrogen and vascularity, which increases the mucus secreted as well.
All right, well, we all hold our breaths in time, and nothing ever happens to us. Does anything ever happen to Layla because of her condition?
Well, her oxygen levels decrease significantly in light of increased need during her pregnancy. This might lead to pregnancy-induced hypertension, diabetes, or depression. Also, it may affect the child, causing increased chance of cesarean interference, intrauterine growth restriction, and lowered upgrade score.
All right, that's a bit unsettling. How do we treat this, or better yet, how do we prevent it from ever happening again?
We have to make sure that she makes a few lifestyle changes in regards to her habits and diet.
The use of adhesive bracing strips could help up with patency. Also, if it persists or becomes severe, it may end up using continuous positive airway pressure machine.
In regards to prevention, keeping your appointments with your healthcare provider could keep you from gaining too much weight. The use of could keep you from gaining too much weight. The using of sleeping pills or sedatives, and of course, he or she would advise you against bad habits.
Oh my God, you're cheating on me, aren't
What?
you? With that young, skinny girl from the office. Is it because I'm fat? You know I'm fat. It's because of you. It's your baby. Oh my God, you're cheating on me.
You're snoring, gasping, kicking me all the time, and taking 90% of the bed space with that huge bell of yours. And out of nowhere, you come to slap me for just a nightmare? This is just a nightmare!
Well, you know what they say? Dreams actually affect reality. So you're really cheating on me. Oh my God.
Honey, you know I love you, okay? But
Well,
I mean,
you love your sleep more than me, don't you?
I trust your rationality, honey. Please, I have to get to work tomorrow morning. I need
You
to
love
get
your
some
work more
sleep.
than me too.
Just listen to me. I will discuss this through later, okay? Just get some sleep.
Okay,
Get back to
I
sleep.
love you.
Get back to sleep.
Well, I don't know whether to laugh or to suspect Gamal. Usually, I don't remember my dreams whenever I wake up, regardless of how long I've been awake. Why would Layla start remembering hers?
The pregnant women's dreams are more vivid and persist in the mind. It's easily recalled after sleep due to many reasons such as urinary frequency and snoring, which causes shortening of sleep interval.
But why would she dream of him having an affair?
The hormonal changes alter emotions, have a brace and go through highs and lows. In this case, Layla has surges of hormones which tend to magnify her responses emotionally.
Alright, well, does that mean that her dreams fluctuate along with her hormones?
Yes, actually. For instance, in the first trimester, with all the changes you're going through, a couple of dreams frequent the women, including dreams of her childhood, of giving birth to a child rather than an infant.
Alright, well, we know that what signifies those two?
She is thinking about experiencing her motherhood. Also, giving a birth to a child rather than an infant would show that she is anxious about fragility or missing out on her child's babyhood. Some women dream of swimming, which that's explained by the amniotic fluid in the uterus. Also, others include fear of challenges like driving a bus or some skyscrapers.
Alright, well, we know that Layla's in her third trimester. What explains her dream?
The third trimester is centered around her anxieties with being a good mother and concerns with the birth process. Also, it involves her insecurities of being unattractive, fears of dangers to the child, desires.
In one of the papers I have read, it mentions that 94% of the women who have good dreams were assertive and self-confident in their dreams. And also, on the other hand, 70% of the women who endured longer labors were having nightmares where they felt like victims.
So Gamal referring to how big she is isn't really helping. What other dreams could Layla expect?
Dreams of labor, because obviously it's almost time and she's worried about it. So there is a maternal concern with something going on with the child, like losing it or dropping it.
Dreams of attackers, fictional or none, resembles the protective instincts acting up. Feeling overwhelmed may lead to dreams of violent association with water, like drowning or tidal waves.
Alright, well, I remember Layla mentioning at one point that she dreamed about her child, about holding her in her arms, testing out the name. What explains that?
That reflects her desire to know the answers to the question about the future.
Alright, well, that's it for what I have right now. I'd like to say and assure you guys that Layla and Gamal will visit their OBGYN tomorrow to go on to a safe but slightly messy, birth. Thank you.
Well, obviously, it's the time for the take-home message to all the doctors out there. The snoring, the gasping, all the other symptoms could actually lead to something. So take proper precautions.
By proper precautions, you mean reduce your caffeine intake, stop smoking, and pay extra attention to your diet. To maintain the average weight, also use adhesive breathing strips.
What about the itching, doctor?
The itching or the discomfort feelings that your legs may suffer from, this is quite common during pregnancy. To deal with it,
Well, you could have a limb massage, a hot and cold bath. However, if you're anemic, take iron tablets.
what about the dreams, doctor?
Okay, the dreams, or shall we say the nightmares, it's actually a normal psychological state during pregnancy. However, what can we do?
Communicate with your spouse, and as a husband, you should pay extra attention to your pregnant wife.
What about the sleeping position?
The best way to sleep in is on the left side.
Okay, thank you everybody. Sleep tight on the left side.
Before we leave, we'd like to say thank you, Dr. Ahmed Abu Nasr, for giving us this opportunity, and to Dr. Nadine for guiding us throughout our journey. Thank you.
The next presentation will be a cross-sectional study, and it was done in Qasr Al Aini Hospital about depression during pregnancy. And it will be presented by Manabawi, Hamza, Asma, Murad, and Hisham.
Hello? Hello? Hello?
أنا هنا مش
In medical school, we learn two important concepts. Firstly, the inclusive approach to medicine, called holistic medicine, which means that we should treat the patient as a whole, rather than just concentrating on the disease or condition. Secondly, that the patient's well-being is not just about the physical state of the patient, but also about the emotional and psychological conditions of the patient. However, in our practice, we often forget about this important aspect of health provision. And that's why, in the last 12 months, working as health officers, our team has addressed this important topic, depression during pregnancy. And now, let facts speak more about depression.
Depression is defined by a state of low mood. When we are depressed, this low mood will affect our thoughts and behaviors, leaving us sad, empty, and hopeless. Depression is known to be the second leading cause of disability worldwide. Women are affected twice as common as men by depression. A sad fact is 80% of depressed people don't receive any specific treatment. And what is really shocking, that 15% of them will attempt suicide at any time in their lives. So, why we choose depression during pregnancy? What is the big deal about that?
Well, that's a very good question. Pregnancy is typically perceived as a happy event. We all rush to deliver the good news to the mother and the family and check the viability and physical signs of the baby. We also check the physical and medical conditions of the mother, forgetting all about her psychological and emotional states. We don't stop to ask ourselves the question, how's the mother is really doing and how is she adapting to such overwhelming changes and fluctuations? But did anybody raise this question before?
Well, unfortunately, most published studies concentrate on postpartum depression, or what we call postpartum blues, because they thought that hormonal levels of the pregnant lady will protect her from having depressive symptoms. But recent studies have found that depression during pregnancy will be as important as postpartum depression. In fact, the meta-analysis have shown that the mother having depressive symptoms during pregnancy will be the strongest predictor of her having postpartum depression. Neglected cases of depression during pregnancy may lead to serious consequences. It may lead to maternal malnutrition, preterm labor, low birth weight, and the mother resorting to smoking and substance abuse as an escape from her depression. In spite of all of this, depression screening in our antenatal care remains surprisingly absent. So, what to do about that?
From here, we decided to take a step forward and conduct a cross-sectional study evaluating depression during pregnancy. Our main aim was to identify the prevalence of depression in our convenience sample. and to study the factors that may correlate to depression during pregnancy.
In order to do that, we have decided to interview our subjects in Arabic using the PHQ-9 or the Patient Health Questionnaire 9, which includes questions evaluating affect, eating and sleeping disorders, and even self-image of the pregnant lady. We also assessed 24 different health-related issues and 6 socioeconomic parameters. Then, inferential statistics were done. We conducted our study in Qasr Al Aini Obstetrics and Gynecology Hospital with both inpatients and outpatients, and of course, with their consent to participate in our study. We had some inclusion criteria as confirmed pregnancy and age above 18. We also had some exclusion criteria as intrauterine fetal death and even non-viable pregnancies as VMO. Over 11 months, from April 2014 to February 2015, our sample consisted of more than 200 pregnant women. And now, let's take a look on the video illustrating the results we came up with.
Now come on with me and let me take you through a journey between numbers and statistics illustrating the results of our cross-sectional study. Through endless people of pregnant women we have interviewed to be included in our cross-sectional study, we have conducted too much interview that we have approached more than 300 pregnant women to be included. However, due to refusals of some and exclusion criteria, we ended up with 217 women as our net subject for such sample. Now, let's take a better look about the representation of such sample. First of all, about the age. Majority of the sample will grow 30 years of age with 64%. Other age variations available more than 40 with 3%. About where they live, either urban, rural, or countryside, were almost similar, around 30% for the whole sample. Now, regarding the income, which was a huge concern for us, the majority of the sample fall in the zone of 700 and 1400 with 42%. However, other variation in the sample were also available. Now, to some pregnancy-related factors, such as the trimester, most of the sample fall in the zone of the 3rd trimester, and other trimesters was also present. About the number of previous pregnancies for such sample, we know we have a high gravidity rate in Egypt that made most of the sample fall in the zone of 2 and 3 previous pregnancies, or more than 3 previous pregnancies, 41 and 46% respectively. A very important piece of information you have to put in consideration is that each single interview took us 15 minutes to be done, and that's give us 3,255 minutes to conclude our sample with data collection. Now let's switch from sample representation to other statistics and inferentials about depression itself. Regarding the prevalence of depression, it was surprisingly high, 35% in our sample, 1 in 3 women, with a PHQ of more than 10. We studied some factors that may correlate to such high prevalence of depression, such as inpatients and outpatients. It was 46 for inpatient and outpatient was 54 with a p-value of 0.71. We studied also like women bearing male or women bearing female. It was 33 and 39 with a p-value also above 0.05. Now, the income we say is a huge concern because we think poor women are more prone to pregnancy, more prone to depression. Let's see how the representation now changes from the representation to the depression percentage. The majority also fall in the zone of 7 and 1400 monthly family income. And the last part is that we asked about previous abortions, a previous condition in pregnancies. Who said yes, they have previous abortion with 35%, and we said no with 65%. Surprisingly, the depression rate was exactly the same, 35 and 65. And this gives us a very important piece of information to conclude our cross-sectional study with, which is depression is indeed evident during pregnancy. It reached a high level of 35%, 1 in 3 women in our sample. It is not related to socioeconomic or medical status of the mother, and most importantly, that each single woman is susceptible to depression during pregnancy.
Wait a second. Does this mean we have to assess for antenatal depression in every pregnant lady?
Well, let's see what the National Institute of Clinical Excellence of UK say. In a woman's first antenatal care visit and at will later contact, screen for depression by asking 2 depression identification questions. The first, during the past month, have you often been bothered by feeling down, depressed or hopeless? The second, during the past month, have you often been bothered by having a little interest or pleasure in doing things?
Yes. Now, if your patient responds positively to either one of these 2 depression identification questions, then proceed for full assessment and diagnosis using the PHQ-9 or Edinburgh Postnatal Depression Scale. As regards to management, firstly, discuss with your patient culturally relevant information about antenatal depression, including its possible risks and postpartum depression. Second, discuss the possible therapeutic options and proceed to formulate an integrated care plan. Then refer her to a competent psychiatrist to initiate psychotherapy or medications while taking in account the gestational age of the fetus. Last but not least, regular monitoring and follow-up remains an essential part of the management process. Now, ironically, it might seem depressing that our results showed such a high prevalence of antenatal depression across all the factors we tested for, both medical and socioeconomic. For behind each statistic lies the agony of countless souls and numerous heartbreaking stories. However, we should not lose hope. We need not despair, for just as the sun rises from the darkness of the night, a glimmer of hope lies ahead for these tragic cases. Early diagnosis and treatment of antenatal depression can help avert its complications and can help prevent postpartum depression.
And since all pregnant women are predisposed to depression regardless of all social and medical factors, we decided to pass on the torch of hope to all of you by putting in your hands a translated version of BHQ2 and BHQ9 so that you can use them in your own practice and possibly make a difference in your patients' lives. Thank you very much.
Thank you, everyone. And I want to thank everyone who participated with us in the past few days in our Twitter hashtag. You could find it outside on the posters outside the hall. Thank you.
Thank you very much for the last group. And before Dr. Madini will present the next group, I hope that you can calm down and stop side speeches, because this will interrupt the presentation.
Moving from depression, coming to love. Love from scientific point of view. And it will be presented by Pasent, Hala, Nada, Minna, Nardine, and Emma.
What is love? It has been, and still, the most mysterious question.
From the first minute he and she first met, till they decided to bond their lives together forever.
The warmth of having a little piece of meat growing inside you, till this become a baby seeing light for the first time.
First time you hold your baby, the everyday bond happens with suckling, smiling, and walking the first steps.
So, can science answer this?
Luckily, yes. Ladies and gentlemen, fasten your seatbelts. We're gonna take you through a journey with an emotion roller coaster. And love
will be the fuel.
When she said there is something about her, and when the Beatles sings something in the way she moves, this something is science. And when it comes to science, it's all about the brain. This shows our different brain areas through our different emotions. And this brain of a lover, a romantic lover. And this one shows the difference between maternal and romantic love.
And all these areas will send impulses to produce hormones all over your body. Today, In our journey, we will get you to know your happy hormones: oxytocin, endorphin, serotonin, and dopamine. First stage is the stage of the first sight love and attraction, starting with the first sight.
Is it really first sight, Emma?
Yes, it takes from 9 seconds to 4 minutes. It's not even the first sight, baby. It's the first voice, smell, even the first feeling.
Oh, why don't we go particularly to her?
Check this out. For ladies, their cycle control their choices due to the action of overleading hormones.
Yes, estrogen makes her likes the more tough, the more decisive, the more masculine. That's why we fall for the bad guy.
And when progesterone working it out, she's into the nice, caring, nerd maybe? I will call him the nice guy.
Yes, women are crazy.
And yeah, don't be over. You don't have to change your guy every part of the cycle.
Just understand that and work on that together.
Coming to the ovulation phase. Ladies here are so attractive and they seek an attraction.
Feminine dress, feminine voice, and feminine pheromones.
Pheromones? What is pheromones?
Pheromones are body-specific smell, representing our major histocomplex, referring to our immunity. We go attracted for those with different immunity.
They use this animal extraction in making expensive perfumes?
Yes, exactly. Emma, it's time to play.
Yeah. So, Helen Fisher has divided people into 4 types, according to their personality and their sampling of their hormonal action. Having the test list in your hand, you can practice it later.
Being an explorer, like Angelina Jolie, the dopamine, you are curious, risk-taking, adventurous, charismatic, and freaking amazing.
If you are cautious, religious, and traditional, you probably like George Washington, the builder-led serotonin.
And if you are flexible, having the whole picture, you are like Bill Clinton, the negotiator, oxytocin and estrogen.
If you are tough-minded, decisive, and a leader, you're like Hillary Clinton, the director-led testosterone. Nardine just came from college, and she looks a little bit worried for me.
Oh, Mother, my heart is beating so fast. Am I ill?
No, dear, you are not ill. How did you met today?
Oh, I feel life is really beautiful and there are birds singing everywhere. Can't you hear them?
Stop those butterflies! This is your dopamine, dear. Lowering your pleasure center exactly like cocaine.
Yes, I remember I've tried it.
You tried cocaine before?
No, I mean, I'm sorry. Is it true?
Yes, it's true. And you're just nice to everyone. You know what? You can help me some housework, sweetie.
But I'm not nice to everyone. I was really jealous of this girl who has just spoken to him.
This obsession and jealous because of your serotonin decrease. Exactly like those obsessive-compulsive disorder.
Oh, darling, don't worry. With the mommy like that, you can fight with her using adrenaline. And if you want dopamine, you can try tyrosine.
And of course, no one wants to be obsessive, even in love. So you can eat tryptophan.
And luckily,
strawberry and chocolate contains both dopamine and serotonin.